Okay, welcome to Level 4 Health and Social Care, Unit 403, which is the Introduction to Healthcare Policy. We're now looking at part 3 of the unit where we're focusing on the coalition policies of 2010 to 2015. The objectives that we're going to be focusing on is 1.2, which is to summarise the Conservative Liberal Coalition Health Agenda 2010 to 2015. And then for you to sort of pick a policy of theirs and discuss it and think about its impact on the service users. So moving on from our previous session, which focused on the Labour policies up to 2010, there was a change of political government. Following an election, the majority was held by the Conservative Party, but not enough to form a complete government. So what they needed to do was to create a coalition with another membership. Now, most people think that there's only two parties in the UK, but there are actually three, two major parties and one fairly minor party who only has a handful of seats. That's the Liberal Party. However, when it comes to this sort of situation, they can often, if they're in agreement, they could be asked by one of the two major parties to help bump up the numbers so they can actually get votes through. And this is what they did, really. They bumped up the numbers. The coalition dangled the Tories dangled the chance of being in power to the Liberal Party because they don't normally get the chance to be in power because there's so few of them. So they would only ever get in power nowadays through coalition. They offered them the chance of being in power by joining them in the coalition. This didn't actually work out very well for the Liberal Party because when the next election came along, strangely, most of the Liberal parties that had worked with the Tories actually lost their seats. So it's actually quite a body blow for this little party and made them even smaller than they were before. However, that's the way it goes. Okay, so we have a coalition government in 2010. And when they took over, the situation with the NHS was fairly good. Funding had increased considerably. Satisfaction was very high with the service users, people, the public in general. Satisfaction was running at more than 70%, which is probably the highest it's been since its formation, really. Waiting lists were down, waiting times were down, interest in people going to private medical insurance were down because that usually only goes up when waiting lists go up and things like that. So there was a general big picture of big expansion, lots of improvement in quality and high satisfaction. So one would say that the coalition, when they inherited the NHS, it was better than it ever had been, really. So they had nothing to complain about in that respect. However, there were a couple of areas, as we identified in the last unit. There were some quality issues which were already highlighted by Labour and remained still with us. There were some systems really that needed improvement, and for example, the public inquiry into the failing Mid Staffordshire Hospital really highlighted some issues in mortality rates and substandard care. And the outcome of this inquiry sort of identified the fact that there was sort of supervisory failure, so management failure within the hospital, but obviously failure of the regulators as well to pick up and do something with it. So that really needed to be addressed. The inquiry made quite a lot of recommendations on the need for enforcing at least a minimum set of standards, and then thinking about how that was enforced. and for improving the monitoring and inspection of these sorts of large services. So this government inherited the responsibility for having to deal with the legacy of that inquiry. So when they came in, this was quite high on their agenda, but it took quite a long time to address. The other issue that hadn't worked very well under Labour, although there was some improvement, was some of the inequalities issues. And again, Labour had identified that towards the end of their term, and they had plans to deal with it, or they were creating plans to deal with it, but the election came along and they didn't get the chance. There were some good outcomes in Labour's period, as we talked about before. Circulatory disease mortality was down, cancer mortality was down, and we still sort of lagged behind some of the best performers, particularly in Europe as well. Smoking prevalence had gone down, we know, because of the measures on the smoking ban. But some of the issues around lifestyle and behavioural, obesity, alcohol, hadn't really gone down as much as they would have liked. And the narrowing of the social class gap in infant mortality had actually gone up. So that had done really well. So, there was some swings and roundabouts under Labour, but there were some issues that needed dealing with, particularly around class, financial class, social class, deprivation, to do with work. Finance issues had changed. To the time of Labour was a time of serious economic growth, so they were able to spend quite a lot of money on the health service. After 2008, there was quite a large financial crisis in Europe, and so money became quite a big issue in the last couple of years of Labour. And then, although they kept to their commitments, when the coalition inherited, they just identified that the amount of spending, especially in those last couple of years, had created a fairly large deficit. They characterise its inheritance one of the most challenging fiscal positions in the world. I think most people would dispute that, really. I think there's a lot of third world countries that had much more bigger financial challenges than the UK did at the time, but it's just their way they put it. So basically, they put the blame on Labour spending. And in fact, Labour was spending when the money was there. So it's only in the last year or so that the money was starting to drop because the government product was going down, really. And that was a financial crash. That was to do with the banking crash that happened. It was very strong in Europe and the US, but it affected other parts of the world as well. So they won the election on. The Tories won the election really on saying, well, we're going to save money, we're going to reduce public expenditure. But they identified that they would have to make cuts rather than increase taxes, because the Tory party is not comfortable with increasing taxes, because it likes people to keep their money. That's part of their sort of philosophy, really. So really, that's going to be an issue for the NHS. So some of the goals of the coalition agreement. Obviously, they had a slightly different background from their philosophies. Tories against Liberals. Liberals sort of tend to stand somewhere between the Labour Party and the Tory Party with their politics. So there was a little bit of work that needed to be done for them to come together. And they had quite a short time to do this because it was after the election, and they usually have a couple of weeks to do it where they decide they want to come into coalition. So they had to do everything very much sort of on the hoof very quickly. But they eventually they created a sort of common ground document to say this is what the coalition government wants to do. And there was a lot of idea. They decided that they agreed that the funding for the NHS should increase in real terms each year, in each year of Parliament. And this pledge has remained sort of all the way through. They also committed to the NHS as an expression of national values, free at the point of use, based on need, not ability to pay. So they agreed to carry the sort of original philosophy through as well. So that sort of tied their hands in a way, because the only thing they could really do, because they'd agreed to keep adding money to it, is to make cuts in other areas, really, if you think about it. The other areas that they sort of took as part of their program was to free the NHS from sort of political micromanagement. So remove the power of the Secretary of State and the ministry in central government, and to sort of devolve a lot more power out to the localities, really, and to the hospital trusts and to the health authorities in different areas. The cut quangos to cut these sort of organised groups that work for the government, really, to remove some of these advisory groups, and to try to cut administration down so that more money is for the frontline staff, which is, makes a lot of sense. And of course, when people heard it, they were quite happy about it. Other plans included sort of enabling GP commissioning, so that the commissioning in the community was based around the GP service, who was you as a service user's main point of contact. Also introducing an independent NHS board, as I said, sort of away from central government a little bit. Developing Monitor, which was the regulator for hospitals. Their main role was really to, gather all the statistics and against targets that have been set up in the Labour area. So they just had a central organisation doing that, who monitored, hence their name, these stats, these regular targets. But they wanted to turn that into something that actually monitored finance as well, instead of just operational targets. And then they wanted to strengthen the role of CQC with their eye on the Mid Staffordshire inquiry, and on the quality issues, really. So they really also wanted to bring local people onto the boards of the primary care trusts, the trusts that work over the community services, to actually get some sort of democratic local involvement as well. They created a white paper, and it came out within 2 months of them coming into power, mainly because it was written by the Tories and they had been working on it, prior to the election, with the hope that they would win the election and be able to put it into place. So it came out very, very quickly. And it began by repeating that commitment about the financing for the NHS. And then it set out a programme of health reforms, which was a whole new framework for the commissioning, management and delivery of health services. So it's very much focused on the bureaucracy, the management and the processes, really. It's very process driven. And it said that health outcomes would be the primary purpose of the NHS. So they're saying they're looking for actual clinical evidence. So, like X amount of people having, not died from lung cancer, things like that. They would be focusing more on that than some of the process targets which used to be reported to Monitor, like whether you'd pass something over to another team within a month and things like that. So, and there was a lot of detail in the Labour years on process, making sure that everyone was meeting sort of time-day turnovers. I do remember having to send in, many returns on my staff teams. Like, have you, when did you review the patient? Was it within the 28-day period and all that stuff? And they said they wanted to get away from that. They weren't really interested in that. All they wanted to know was that the outcome, did Mr. Bloggs have his operation? That sort of thing. So they were looking for much higher level statistics.